Cataracts can be defined as the opacification of the lens that occurs usually in the older age and that can affect the vision of the person. They can basically occur bilaterally and sometimes they are present unilaterally in a person. There are different causative factors for the development of this cataract formation in a person. There are different systemic illnesses that can contribute towards the development of the cataract formation in a person. For example, diabetes mellitus and basically hypercholesterolemia. These are some of the causes which can basically relate towards the development of the cataract formation in a person. So usually in the older age group, that is usually the seventh or the eighth decade of life, people present with this vision loss that is usually central, or in the basically the peripheral vision is not affected usually by the cataract formation in the earlier stages. The person would usually give you a history of the vision loss that is usually centrally based. So that is the highlight over here. And again, one of the factors that we have to consider over there is the patient particulars, that is the age, the gender. All of these basically make the person more prone to the development of the cataract formation. We usually classify cataracts depending upon the causative factors. Then we have the morphological classification, that can be the nuclear cataract, we have the cortical cataract. The most common type of the cataract that we usually clinically observe is the nuclear cataract that we usually encounter during our outpatient departments. So this is the out basis for the cataract formation. One should know how to treat these cataracts. Usually, the phacoemulsifications are implied for the treatment of the cataract in a person. This is usually a surgical procedure. A minimally surgical or a minimal innovation is basically used over here. The lens is cut out and that is basically sucked out through different laser equipments. So usually it's quite a minimally used surgical procedure. Nowadays, researchers have basically carried out different researches against this cataract, against these cataract surgeries, and a lot of eye drops have been implied as a part of the research work just to know if the patient can avoid surgery and can basically relate to these eye drops, and these cataracts can be resolved through the use of these topical eye drops. Usually L-carcinoid is the most effective drug that is being used nowadays for the resolution of the cataract formation. When basically you want to know about the pathophysiological basis of the cataract formation, one should have the basic knowledge regarding the lens anatomy, and that we're going to discuss over here in this very first section. There are these typical structures in the lens that are quite prone to the traumas, that are quite prone to the infectious and the inflammatory states in the body. Either it can also be the autoimmune disorders that they can be related to. So these are the different causative factors that can contribute towards the development of the cataract formation in a person. We'll be discussing the anatomy of the lens in detail over here. What are the typical structures which basically form the basis for the development of the cataract, the structural formation of the lens, and finally, we'll be discussing the epithelial structure of the lens. The epithelium of the lens, it has its particular characteristics, so that we'll be discussing over here in this very first section. The anatomy of the lens. When we discuss or when we look at the human eye and look at the lens of the human eye, it's basically a biconvex structure that is attached to the ciliary processes by the zonular fibers between the iris and the vitreous humor. So this is the basic anatomical position of the lens in the human eye. So what are the different structures? If we look at grossly, at the eyeball or at the eye, we usually see that we have the lens that is situated right over here, and that is basically speculated by the zonular fibers on both sides. So this is basically the suspension right in the middle and on both sides, and basically radially we have the iris that is located over there. The iris is located radially. We have the lens situated over here. So this is the gross anatomical position of the lens in the eyeball. When we look at the structures of the lens or the lens fibers that are situated over here, we have the young lens fiber cells that are situated peripherally, and then centrally we have the secondary lens fiber cells. So this is that we have to distinguish between the younger lens fibers and the secondary lens fibers. Topically, we have the lens capsule that is basically giving a protective layer towards the lens fibers. And then we have the primary lens fiber cells that are situated right in the middle. Anterior lens epithelial cells, they are forming the epithelium or they are forming the lens capsule. We have the epidermal lens epithelial cells over here, and over here we have the transitional lens fiber cells that are located most topically. So this is the formation of the lens fiber or the situation of the lens fiber. We have a range of lens fibers that are basically radially located, and one should know the structural formation of the lens fibers. Basically, lens is a non-vascular structure and it's colorless and as well as it's transparent. So these are the peculiar characteristics that we have to know just to have the baseline information regarding the lens that we're going to study. The index of refraction is almost, in a normal person, it's almost 1.336. So over here, if we have a look again at the structures that are present in the lens, again we have the capsule that is basically surrounding, that is providing the protective layer towards the lens. We have the epithelial layer that is basically a thin epithelial layer. Then we have the cortex, and then we have the nucleus. So again, it's very important to know these terminologies, because furthermore, when we'll be classifying these cataracts, one should know that when we regard as the nuclear cataract, it's basically the opacification that occurs in the nucleus of the lens. And when we say the cortical cataract, we're talking about this area that is basically situated more peripherally. And we're talking about the opacification of the lens in this area. So we have a nucleus, we have a cortex, we have a protective covering, which is basically the epithelium. This is the posterior surface, and then we have the anterior surface. The aqueous humor is present in close relation to the anterior surface, and then we have the equator of the lens, that is basically the midline that is passing through and through the structure of the lens. It consists of the stiff elongated prismatic cells known as the lens fibers and very tightly packed together, divided into the nucleus, cortex, and the capsule. So basically, these are the three terminologies that we'll be using again and again. One is the nucleus, we have the cortical area, and then we have the capsular area. So the whole lens is enclosed within an elastic capsule that is providing the protective covering, protecting the lens from any insults. For example, it can be a trauma, it can be an infectious or inflammatory states, helps to refract the incoming light and focus it into the retina. So this is the main function of the lens, to make an image on the retina. So if it's not functioning properly, the light is refracted in an abnormal way, and it's not going to form a clearer image or a distinct image on the retina. So this is the main pathology that is basically occurring due to the opacification of the lens. The structure of the lens, we've already now studied that we have a lens capsule, we have an anterior lens epithelium, and posteriorly we have the lens fiber. So basically the epithelium is not going through and through, it's only present anteriorly, and posteriorly we have the lens fibers. So usually the opacification occurs posteriorly. We have the posterior cataract, that is usually posterior subcapsular cataract, that is present in most of the cases. Over here, you can see this anterior portion that is basically situated along with the epithelium. So there is this protective covering over here anteriorly, and posteriorly it is basically lacking this epithelium. Over here we have a bow region that is basically situated on both sides, that is medially as well as laterally, and we have the cortical fibers, and then centrally placed we have the nuclear fibers. So this thin transparent collagen membrane is basically providing the protective covering, surrounds the lens completely, elastic in nature but contains no any basically it is not containing any elastic tissue. It is anteriorly secreted by the lens epithelium and posteriorly by the basal cells of the elongating fibers. So the anterior lens epithelium, if we look at the histology of the lens epithelium, we would see that the first and the foremost layer is of the lens fibers, and then we have the anterior lens epithelium, and then finally we have the lens capsule over here. So this is the basic histology that we should know regarding the anterior lens epithelium. It is basically a single layer below the lens capsule, formed of the cuboidal cells and becomes columnar at the equatorial region. So this is the distinctive epithelium in which we have the cuboidal as well as the columnar cells that are basically located along the equatorial region. When we look at the lens fibers, if we look at the diagrammatic representation, it's basically the elongated primary lens fibers that are centrally located. We have the neurosensory retina that is located just at the back. And then we have the cuboidal anterior lens epithelium. And this is basically showing the surface ectoderm over here. So the epithelial cells elongated to form, they are basically elongated to form the lens fibers. It's basically a complicated structural formation. Mature lens fibers are cells which have lost their nuclei over here. Then we have the lens fibers on the other hand. When we look at these lens fibers, we have the cortical areas, we have the nucleus that is basically centrally located, and then we have the anterior lens capsule and the epithelium, and posteriorly we have the posterior lens capsule that is situated right over here. The posterior lens capsule, the fibers are basically elongatedly and horizontally placed just like this, and the anterior lens capsule and the lens epithelium is located right over here. We have this equatorial lens bow, which is again the termination of the epithelium is marked over here. So this is the marking that we should keep in mind when there is a termination of the epithelium. It is basically regarded as the equatorial lens bow over there. As lens fibers are formed throughout life, they are arranged compactly as nucleus and the cortex of the lens. So we should know these cortical areas. We should have these terminologies clear in mind when we regard them as the equatorial area of the lens or the cortical area of the lens, or either on the other hand, we can regard them as the nuclear area of the lens. These are basically forming the basis towards the morphological classification of the cataract formation. Again, if we have a look at this, these dot opacities are sometimes present. They are present obviously pathologically. This is the anterior side, and this is basically the posterior side that I'm marking over here. It is the peripheral part which comprises the youngest lens fibers, and this peripheral part is not affected in most of the cases. The mature lens fibers that are placed basically towards the nucleus, they're usually affected from the opacification. This is basically a diagram again showing the lens capsule, the lens cortex, the lens nucleus. Just to give you a better view regarding the lens nucleus, the central part containing the oldest fibers. So again, the oldest fibers are going to be affected more predominantly. The different zones laid down successively as the development proceeds. So one should keep this in mind as well. The different zones are the embryonic nucleus. It can also be affected by this phenomena. The fetal nucleus is affected. And then we have the infantile nucleus, and then finally we have the adult nucleus. So these are the different terminologies that we'd be using clinically while you're dealing with the patient. Depending upon the history, depending upon the age of the patient, you're going to basically document accordingly what kind of the zone is affected in that particular patient for whom we are writing down the history. So over here in this section, basically we summed up the anatomical structures that are basically relating towards the cataract formation. The opacifications can basically occur in these different anatomical zones of the lens. Either it can be the nuclear zone, either it can be the cortical zones that are usually affected in a particular person. And then we have the subcapsular zone. So all of these zones and all of these terminologies have to be remembered when we're basically morphologically classifying the formation of the cataract. So that is basically the end to this section. Thank you for watching sqadia.com.